Let's talk about soft tissue mobilization, soft tissue maintenance. One of the things that happens in surgery is that we're going to do a lot of compensating, that you're going to be carrying a limb around or not moving your shoulder as much or maintaining or minimizing ranges, and it's possible to end up feeling stiff. And a lot of people come to the clinic and actually talk about the fact that they feel wretched, and it has nothing to do with their surgical leg or surgical elbow or what's going on. It's the rest of their body. So this is part of the physical practice around taking care of the body as it compensates for the missing or protected limb or protected range. That developing some kind of input, this therapeutic input on the rest of the tissues, can go a long way. And sometimes we're going to be immobilized and we're not gonna be able to move that limb. If you can't bend your leg, except for dangle it a couple days into the table, that rectus is gonna get stiff, the hamstring is gonna get stiff, your calf is gonna get stiff. So what is your plan to deal with that? Well, easy. You're just going to hire a massage therapist and they're going to show up at your house every day and give you an hour massage. Said no one ever. That never happens. And if you can get a massage, fantastic. That is a great thing to do. However, don't forget that you can get on the ground, lean up against the wall, sit on a chair, and mobilize the rest of your body. And you can also mobilize above and below your surgical site, whether you're using percussion or vibration, you like those tools. Don't forget that the rest of your system is compensating and that there's a lot of real stress engaged with this. You know, we're big fans of having a breathing practice. We're big fans of doing as much non-exercise activity as we can. We're trying to keep enough input in to keep the machinery alive and keep you cardiovascularly intact, but also it's very simple to do a little bit of soft tissue work. Just want to give you a couple highlights. If you're on the ready set, you probably are following along on some of our follow-on videos. So all of them are going to be appropriate. Obviously, don't mash or mobilize directly on your incision, but up and downstream really is a simple way to make sure that we're not seeing loss of slidability. We're not seeing loss of movement in these tissues because they're congested and immobile. Some of the simplest rules are we like to go side to side, and just like cross friction. And this side-to-side motion allows us to address some of the other aspects of the tissues as the calf. So if I've just torn my Achilles, I can still keep it in this position and move back and forth. If I'm getting any pain in my surgical site, go lighter, move the roller, adjust. So if I had an Achilles tear here, working on my calf tissues would be totally appropriate. I'm going to be protected. I might be in a boot that keeps me locked out. And if the boot is here, I can still work right above the boot. One of our friends said, one of the reasons we like to go side to side, just like when you cut a steak against the grain, the idea here is to make it more accessible and chewy. So don't feel like you need to go up and down. We cut against the grain for a reason. It allows me to address the tissues as a greater aspect or greater part of the whole. If you find something that feels stiff, painful to compression, that's okay. It's normal. Your body is throwing a lot of error messages right now. And so part of what we're trying to do here is change fluid dynamics, restore how tissues are sliding, improve blood flow, and get some non-threatening input into the body. So you shouldn't be dying. Remember, always have to be able to take a full breath here. That's normal. If I can't take a full breath on a tissue I'm mobilizing, I want to be curious about that spot, and I want to find a pressure where I can still take the full breath. If I find an ugly spot, a trigger point which sets up, we see a lot of dysfunction where people are carrying around, they've healed, but they're carrying around a lot of compensatory dysfunction up the chain from their surgery. This is one of the ways that we try to prevent that. And that is, I'll stop on something that feels uncomfortable or stiff or I don't like, and I'll take a 4-second inhale, and I'll contract and just do an isometric here. And that's basically what we've been talking about this whole time. How do I get input into this brain for 4 seconds here, and then relax as I soften and relax for 8 seconds. That 8-second exhale is also a wonderful way to help manage pain symptoms. So if any time I'm looking for additional pain control, remember, I lengthen my exhale. So if I've got a ton of pain in the system, sometimes just putting in some non-threatening input to the quads, to the hamstrings, to the calves, away from the surgical site can do a lot to tell the brain, hey, it's okay. Look at all of this movement and input into the system that we're getting, which can help sort of change how the brain is perceiving the really highly sensitive surgical site. You'll see that when people are in a lot of pain, they don't want to touch, and there's a lot of fear here. So teaching myself to be able to contract, be able to feel these things can go a long way to just reintegrating that tissue back into that sensory position. If I can't get on my stomach, because let's say I was locked out, pressure of any kind can work really well, and stopping and dropping in that contract relax can be very effective. Don't be afraid to do multiple sessions a day. You may have a lower extremity kind of surgery related problem, but it may be that your traps or your lats or your forearms are really worked from being on the crutches. So the idea here, as we always do with our athletes, is to more closely conjoin how my body's feeling with the soft tissue choices that I'm making, with that down regulation choices. Input into the system of any kind tells the brain to normalize what's happened, normalize that trauma. It's easy to work on the areas away, obviously, and then the areas upstream and downstream. And remember, you're right. If your brain is telling you that rolling on this is going to hurt you, then listen to that protective mechanism. Work further away, work at an appropriate pressure, contract, relax, work on that breathing to see if you can help to de-escalate how that brain is thinking about that surgical site. And hopefully, then once the tissues have knitted out, you're ready to go, and we don't have to kind of dig you out of a hole of compensation and stiffness and patterning so we can get back to normal.